For our Research Updates Q&A session, we have Dr. Matthew Goodwin, Harvard Medical School, and Dr. L. Penny Rosenblum, American Foundation for the Blind, and our moderator, Dr. Jose Blackerby, CAST.
Hello, everyone. I'm Jose Blackerby from CAST. I'll be moderating the Q&A session. I want to thank you, Penny, and thank you, Matthew, for really timely and impactful updates on research. So this first question is for you, Matthew. Jane Hardy asks, this study is phenomenal. Just to have 3 minutes warning of an outburst is very helpful. What if a student with autism can't tolerate wearing something on their wrist? Is there another spot for the device?
That's a very good question. So far, we have only tested with the device on individuals' wrists, although there are other published studies that use the E4 biosensor Bioempatica on the ankle and have received comparable results for signal quality. If an individual has sensitivity to the wrist, there's a high likelihood that they may also have sensitivity on the ankle. And I think here we're going to capitalize on Moore's law that technology just gets better and smaller and cheaper and more powerful as time goes on. And we're very eagerly watching work that is being done right now in the engineering field and material sciences, especially promising our temporary electronic tattoos that one can essentially spray on the surface of the skin. And those are, by and large, imperceptible and give quality signal. So as that research materializes into more widespread use, I think that might be a nice way for us to get the data that we need for the algorithms without having an individual wear external device on the body.
Thank you. We have another question here for you, Matt. It's from Adivenka. I think I apologize for getting that name wrong. But she is asking about when devices like these might be available for students and families.
I get that question often. I wish I could say sooner than later. The E4 is off the shelf. You can buy that. But the algorithms for detecting the features and making the prediction and giving real-time notification do not yet exist. We are working on that. I am eager to see this available to end users who would like it, but I really want to be sure that we have tested it for safety and efficacy before it is released. The good news is that given the high demand I've received from caregivers, parents, and clinicians, we're also exploring commercial partnerships so that as our research shows that there is safety and efficacy, we can quickly try to convert this into a publicly available product. So I wish that day could come sooner than later, but I think the testing needs to be adequate first. And when that's finished, I will very much broadcast that this technology is available, and hopefully we can get it to the people who need it the most, the quickest.
Great. Let's see. So there is another question for you, Matt, from Karen. Dr. Goodwin, did your research look at any correlation between aggressive behavior and access to speech therapy / AAC technology?
So we have not. We oversampled for individuals who are minimally verbal because we think that they may have a more difficult time regulating and expressing emotion, but I don't know about their access to AAC. It's a very good question, and it's one that we may be able to follow up on post-discharge. So to be very clear, the participants that we are collecting data from are in a psychiatric inpatient hospital. So we only really have information about them over the period of their length of stay. But subset of those families have agreed to be recontacted for research. And so those are follow-up questions that we could pursue. It's a nice suggestion.
Great. So we don't have any other questions in the Q&A box at the moment, but if you have them, please go ahead and put them in there and we will respond to them. While we're waiting for that, I thought maybe we could discuss, both of you actually reported on, well, in your case, Matt, you reported on some research from I forget the name of the foundation that was looking at the service.
The Simons Foundation and the Spark Survey, correct.
Yeah, about the loss of services and so on. And Penny, you're working on that. I think I would like just, I was struck, Matt, by the data, like by the starkness of the data. I think it's something similar to the health data and the economic data that we see now, that, that the numbers are shocking, right? That they're much, much worse than we ever would have thought.
98% have a disruption in service, according to that survey. Only 35% are getting remote solutions, and over 90% mental health issues, both on the part of the parent and the child, as a result of that disruption. Seems to me that should be a call to arms for more remote monitoring, consultation, and outcome assessment.
Yeah. And Penny, what are you hearing, absent the survey results, about that issue for students with visual impairments?
We're definitely hearing anecdotally through talking with other organizations that teachers of students with visual impairments and orientation and mobility instructors in some places are being told that they can't even deliver services to students. And that when students are in public school classrooms, teachers are pre-recording videos that aren't accessible to students, and our teachers of students with visual impairments are struggling to connect with those general ed teachers to talk about accessibility, to see, hey, what can we do here? And many of our teachers of students with visual impairments and orientation and mobility instructors, like everybody else, had very little warning that schools were shutting down. So they left without equipment, and our students often left without equipment. So a student who may have a computer at school that has JAWS screen reading software, for example, that computer's at school and that child's at home without access to the technology that would allow them to do some of their schoolwork. So those are issues. And then for our students with multiple disabilities who learn more with hands-on, very individualized instruction, parents aren't equipped to be teachers, and many of the parents are, like all of us, on overload. They're trying to balance childcare with working, with getting supplies for their family and worrying about health. So they don't have a lot of time in their bandwidth to be able to learn from the teacher's strategies they can try with their child. So we have a lot of students and a lot of professionals who don't have the resources they need to be able to continue education effectively.
So I have a question for both of you, and you'll have a minute to answer it. So what do you think the long-term consequences are going to be of this disruption? Obviously, we're in the middle of an emergency at the moment, but how do you think service delivery for children and youth on the spectrum and students with visual impairments is going to be changed in the future?
I'll go ahead and start. I think that in the short term, we're going to need to think about sort of training the trainer models. I think reliance on brick and mortar and a highly trained staff where you take your special learner to a special place is very much now disrupted. So how do we think about technology and materials where we can basically train parents to be paraprofessionals or other allied health professions in community health settings to provide some of those services? I also think that technologies that could be used in the home that help people to become better able to manage their life situation and convey information to experts at a distance so that they can get more tailored and custom kind of feedback. And I would like to think, right, the silver lining of COVID is that we are less risk averse in innovating in service delivery and in education during this time. And once these restrictions hopefully are lifted and we're all sort of back out into society, that we will see that the advantages and the reach of those technologies may then also transfer to individuals in rural locations who have a lower socioeconomic status, may have lower health literacy, getting it out to segments of the population who have inequitable access to mainstream healthcare and education. So I'm hoping that this community is going to help advance not only its own supports, but enable supports for many others.
Thank you. Hey, Penny, we will try to get answers to some of these other questions that I missed. I do apologize. Dr. Rosenblum, this is from an anonymous person. It has been difficult for me to provide services for my low vision and blind students when the team does not want to collaborate. What would you suggest?
I think that's a really challenging question. I think during these times, it's hard to get people together to collaborate because they are being spread so thin. I always think it's important to put it in perspective from the child's point of view. What is this child missing out on? How can we all work together for this child, as opposed to, hey, as the ex-professional, this is what I need, but to bring the focus back to the child and what supports that child needs. I also think when we have a child who is capable of explaining and advocating for themselves, if they could make a quick video to share with the teachers, or the family member can share their perspective, sometimes hearing it from the child and or the family is more powerful than hearing it from us as professionals.
Thank you. I want to thank the two of you for your presentations. I think we have run out of time. Thank you to all of those of you who asked questions, and enjoy the rest of the conference, and be safe. Thank you.
Thank you for having us. Be safe, everyone.
Thank you so much.